I want to tell you about a patient I will call Patricia. 71 years old, type 2 diabetic for 9 years. Blood pressure managed with 2 medicines. Chronic fatigue she had accepted as part of getting older. Joint pain in both knees she assumed was arthritis. Brain fog she assumed was age. Weight that had been gradually creeping upward for a decade despite eating what she described as a reasonable diet. Patricia came to me not because of a dramatic health event. She came because her daughter had been reading about sugar and pushed her to have a conversation. I made one suggestion, just one. Remove added sugar from your diet completely for 30 days. No calorie counting, no dramatic dietary overhaul, no expensive supplements or programs, just remove the added sugar. Patricia agreed. Reluctantly, she did not think it would make much difference. 30 days later, she sat across from me and said something I hear regularly but never stop finding meaningful. I feel like I got 10 years of my life back. Her fasting blood sugar had dropped significantly. Her blood pressure had reduced enough that we discussed adjusting one of her medicines. Her joint pain was measurably less severe. Her energy was better than it had been in years. She had lost weight without trying, and her thinking was clearer. In 30 days, one change. Today, I am going to explain exactly what happened inside Patricia's body during those 30 days, day by day, system by system, so you understand not just what to do, but why it works, and why it works so fast. First, the scale of the problem. The average American adult consumes approximately 77 grams of added sugar every single day. That is about 19 teaspoons. Every day, the American Heart Association recommends no more than 25 grams per day for women, 36 grams for men. Most seniors are consuming 2 to 3 times the recommended amount, and a significant proportion of that sugar is invisible, hidden in foods that do not taste sweet. Bread, pasta sauce, salad dressings, yogurt, soups, breakfast cereals, condiments. The sugar is there, the label rarely highlights it, and the body is responding to every gram. Here is what added sugar is actually doing inside a senior's body every single day. When sugar enters the bloodstream, it causes a rapid rise in blood glucose. The pancreas responds by releasing insulin, the hormone that tells cells to absorb that glucose and use it for energy. In a young, healthy body, this system is efficient. The glucose is absorbed, insulin drops back down, balance is restored. But after decades of repeated sugar spikes, and particularly in the presence of the metabolic changes that come with aging, something changes. The cells begin to respond less effectively to insulin's signal. They become what scientists call insulin resistant. The pancreas has to produce more and more insulin to achieve the same effect. This state, insulin resistance, is the foundation of type 2 diabetes. But it is also the foundation of something else, something most people do not connect to sugar at all: inflammation. Chronic, systemic, low-grade inflammation throughout the body. Sugar, particularly fructose, which makes up half of table sugar and all of high fructose corn syrup, drives the liver to produce inflammatory compounds. These compounds circulate through the bloodstream. They irritate the lining of blood vessels. They make joints more sensitive. They cross the blood-brain barrier and affect brain function. This is why Patricia's joint pain improved. This is why her brain fog lifted. This is why her energy returned. The inflammation that sugar was constantly feeding was starved. Now let me walk you through exactly what happens in the body when sugar is removed. Week by week, days 1 to 3. The first few days are the hardest, and it is important to know this so people do not give up. When sugar is removed, the brain, which has adapted to regular sugar hits, sends signals for more. Cravings, irritability, headaches, a feeling of being slightly foggy or low energy. This is not weakness. This is the brain recalibrating its reward and energy systems. It is real. It passes, usually by day 3 or 4. During these first days, the body is also beginning to reduce insulin output. With less sugar arriving, less insulin is needed, and lower insulin levels trigger the first shift in fat metabolism. The body begins to access fat stores more readily for energy. Days 4 to 7. By the end of the first week, most people notice something unexpected. Their energy is more stable. Not higher necessarily, but more even. Less of the post-lunch energy crash, less of the mid-morning slump, less of the desperate need for something sweet at 3 p.m. This is because the blood sugar roller coaster has begun to flatten. Instead of peaks and crashes driven by sugar, the body is running on a more consistent fuel source. Sleep often improves during this week. Elevated blood sugar interferes with sleep quality. As it begins to normalize, sleep becomes deeper and more restorative. Blood pressure begins to move. Fructose directly stimulates the production of uric acid in the body, which raises blood pressure through specific pathways. As fructose is removed, blood pressure often drops measurably within the first week. This is partly why Patricia's blood pressure responded so quickly. days 8 to 14, weight begins to drop in the second week, and this happens faster than most dietary changes because of a specific mechanism. Sugar causes the body to retain water. Specifically, elevated insulin causes the kidneys to hold on to sodium, and sodium holds water. When insulin levels drop, the kidneys release sodium and water follows. Many people lose 2 to 4 pounds in the first 2 weeks of removing sugar. This is largely water weight, but the visual change is real and motivating. More importantly, the reduction in circulating insulin allows the body to access fat stores it was previously locked out of. Real fat loss begins. Joint pain often reduces noticeably during this second week. The inflammatory compounds that sugar was driving, particularly in the synovial fluid of the joints, begin to decrease. Stiffness that people assumed was purely structural arthritis begins to lift. Brain function improves. Research has consistently shown that high sugar intake impairs memory, concentration, and processing speed. As sugar is removed, and as insulin sensitivity begins to improve, cognitive clarity often noticeably improves. The fog lifts. Days 15 to 30. By the third and fourth week, the changes become systemic and measurable. Fasting blood sugar drops. In diabetic and pre-diabetic seniors, this change can be significant enough to warrant a review of medication dosing. This is why anyone on diabetes medication who removes sugar from their diet should monitor their blood sugar closely and stay in contact with their doctor. The medication dose that was appropriate with high sugar intake may become too strong without it. Triglycerides drop. Dietary sugar, particularly fructose, is the primary driver of elevated triglycerides in most people. The liver converts excess fructose directly into triglycerides. Remove the fructose and triglyceride levels fall, often dramatically within 30 days. HDL, the good cholesterol, often rises. This is a direct consequence of improved insulin sensitivity and reduced triglycerides. Skin often improves. A process called glycation, where sugar molecules attach to proteins in the skin including collagen, is one of the primary mechanisms of skin aging. Less sugar means less glycation, less visible aging, clearer, more even skin tone. The liver begins to recover. The liver is the primary site where fructose is processed. In many people, particularly those with central obesity, excess fructose has been depositing as fat in the liver. A condition called non-alcoholic fatty liver disease affects approximately 25% of the global population and is primarily driven by sugar and refined carbohydrates. 30 days of sugar removal allows the liver to begin clearing this fat. Liver enzyme levels, if elevated, often begin to normalize. Cravings change fundamentally. By day 30, most people report that intensely sweet foods that they previously craved now taste too sweet. The palate recalibrates. The reward system in the brain, in which was responding to sugar with dopamine hits, resets to a lower baseline. This does not mean sugar stops being appealing, but the compulsive need for it diminishes significantly. The important question: what counts as added sugar? Added sugar is sugar that has been added to food during processing or preparation. It does not include sugar that naturally occurs in whole fruit or plain dairy. The sugars to remove are table sugar added to tea or coffee, honey and syrups including maple syrup, sugar in manufactured foods, biscuits, cakes, sweets, chocolate, fizzy drinks, juices, flavored yogurts, breakfast cereals, ketchup, salad dressings, pasta sauces, and any ingredient ending in "ose" on a food label, glucose, fructose, maltose, sucrose, dextrose. All added sugars. Whole fruit contains sugar, fructose, but also contains fiber which slows the absorption dramatically and prevents the blood sugar spike that refined sugar causes. 1 to 2 portions of whole fruit per day is fine during this process. What about artificial sweeteners? This is one of the most common questions, and the honest answer is nuanced. Artificial sweeteners do not raise blood sugar directly. In that sense, they are better than sugar for glycemic control. But research suggests they maintain the craving for sweetness. They do not help the brain recalibrate its sugar reward system, and some research suggests they affect gut bacteria in ways that may negatively influence metabolism. The most effective approach for the 30-day reset is to remove both added sugar and artificial sweeteners where possible. The goal is to reset the sweetness threshold. Artificial sweeteners prevent that reset. After 30 days, if some artificial sweetener use continues, the metabolic benefits are still significant compared to regular sugar consumption. Practical guidance for the first week: read labels before purchasing any packaged food. Look for total sugars and added sugars separately. Aim for foods with less than 5 grams of added sugar per serving. Replace sweet snacks with nuts, cheese, eggs, plain yogurt, or whole fruit. These satisfy appetite without triggering the insulin response that drives further cravings. Replace sugary drinks with water, sparkling water, plain tea, or black coffee. Drinks are one of the largest hidden sources of sugar for most people. Eat protein with every meal. Protein stabilizes blood sugar and reduces sugar cravings. A protein-rich breakfast specifically reduces sugar cravings throughout the entire day. Tell someone. Accountability significantly improves compliance for dietary changes. Tell a family member. Tell a friend. Knowing someone else knows makes the commitment more real. The important safety note. Anyone taking medication for diabetes must monitor their blood sugar carefully when removing added sugar from their diet. The dietary change can lower blood sugar significantly, and the medication dose that was appropriate before may need adjustment. Please do not make this change without telling your doctor if you are on diabetes medication. The change is positive, but the medication interaction needs to be managed carefully. Patricia came back to see me at 3 months. She had maintained the change. It had not been difficult after the first week. She told me the hardest part was reading labels in the supermarket for the first month. Her HbA1c, her 3-month blood sugar average, had improved significantly. Her doctor had reduced one of her blood pressure medicines. Her knee pain was manageable without regular painkillers for the first time in years. She was not cured of diabetes. She was not cured of her blood pressure condition, but she had changed the internal environment in which those conditions were operating, and the conditions were responding. One change, 30 days, measurable results across every major system in her body. Your action steps from today. 1. Calculate how much added sugar you are currently consuming. For 3 days, write down everything you eat and drink. Look up the added sugar content. Add it up. Most people are genuinely shocked by the total. 2. Commit to 30 days of removing added sugar, not reducing, removing. The reset requires the full 30 days to show its full effect. 3. If you are on diabetes medication, tell your doctor before you start and arrange closer blood sugar monitoring during the first 2 weeks. 4. Share this video with someone who keeps saying they will reduce sugar but has not yet found a reason compelling enough to actually do it. Patricia's story is that reason. Subscribe for new videos every week. Information your appointment does not have time to deliver. I will see you in the next one.